So we've talked about sinus bradycardia, and we've learned that sinus bradycardia is not an arrhythmia, but instead it is a sign or symptom of an underlying condition, and our focus needs to be on finding and correcting that underlying condition. You don't always have that opportunity, and you don't always know what the underlying condition is. So there are times in which we're going to have to treat the underlying rate, because that rate, being slow, is what's making the patient so symptomatic. So first things first, always give patients oxygen who are bradycardic. Second, start an IV, give some IV fluids. Even if you don't think they're hypovolemic, because that increase in preload sometimes can fix the problem. Third, if we're going the medicinal route, the first drug you should consider is atropine sulfate. So that's what we're going to look at right now. Atropine sulfate is a parasympatholytic. Remember that suffix lytic means that it goes against. So it doesn't mimic the parasympathetic nervous system, it goes against the parasympathetic nervous system. So it's a parasympatholytic. Specifically, atropine is a muscarinic acetylcholine blocker. Another drug that we have that we use very commonly that's a muscarinic acetylcholine blocker is ipratropium bromide, also known as Atrovent, which we're going to look at in a couple of weeks. So this is an acetylcholine blocker. We have another drug that blocks acetylcholine receptors that we talked about with RSI, and that was, your succinylcholine and your rocuronium and your vecuronium. But remember that they are acting on nicotinic acetylcholine receptors. Now we are acting on muscarinic acetylcholine receptors. So atropine does not increase the heart rate. Instead, what atropine does is it helps to stop or inhibit the process which may be causing the heart rate to be slow. So if you take away that parasympathetic tone, then the heart rate theoretically will increase. And that's how atropine works. But it's not a sympathomimetic, so it doesn't stimulate alpha or beta receptors. Instead, it just takes away the parasympathetic response, and that normal sympathetic tone should take over then, and the heart rate should increase. That's only going to be true, though, if the underlying cause of the bradycardia is vagal-induced. Vasovagal syncope is a common reason, or a common example, I guess, of this, in which vasovagal response causes the heart rate to get slow and the blood pressure to get low. So atropine sulfate, muscarinic acetylcholine antagonist. It's a parasympatholytic. Its adult dose is 0.5 milligrams IV or IO. 0.5 milligrams per kilogram IV IO. It's not a weight-based drug, so there's no kilograms in there. It's 0.5 mg IV IO. I may repeat this every 3 to 5 minutes with a max dose of 3 milligrams. So 0.5 milligrams IV-IO, may repeat every 3 to 5 minutes as needed for a max dose of 3 milligrams of atropine sulfate. What else might we think? What else might we use to treat symptomatic bradycardia? There are several different drugs. We're going to breach the surface today. You know what? We'll do that in a different video. I'll see you in a second.